So, some of the top tips, though, for managing your diabetes, I think a lot of the medicines taken for diabetes can work through your kidneys, and just because of that, also, you should make sure you're drinking enough water. But also, water keeps you full as well. All your organs need it as well to function well. And the goal for water is the rule of thumb half your body weight. So for a 150-pound person, you're talking about 75 ounces of water a day, maybe about 4 to 5 of those 16-ounce bottles that we have there. Those are 16 ounces, right? And I find a lot of times patients are drinking maybe a bottle a day or two a day, and that can really affect your metabolism, it affects your kidney function. Many medicines like metformin, the newer drugs that work through the kidneys, they also affect the kidneys. And if you don't have water there, those drugs, first of all, may not work well, or they may cause damage to your kidneys. And so definitely try to make sure you're drinking plenty of water. I do understand, and maybe those patients that may have other health issues like congestive heart failure, sometimes you're restricted on that, but those that don't, water will definitely help. I had a patient I just saw yesterday who, diabetic patient, her blood sugars have been running pretty high, not really taking her medicines, doing what she needs to. And she saw me last month because she'd been pretty severely constipated. And we talked about diet, and I got her to make some changes there. And then I asked her, how much water do you drink? Maybe about 2 or 3 cups a day. And just by her changing the amount of water she drinks, I saw her back yesterday, and she said, I don't even have to take all those medicines you gave me, and I didn't even have to bump up my fiber that much. I just started drinking the amount of water you told me, and my bowel movements are back to being regular. So it affects everything. It affects, those patients that have constipation. I mean, you need the fluid there to move things along.